Rush Show, and we have a special guest today on this Monday, the 7th of February. And you see my thermometer outside is 24.4. And that background is not in Kane County. That's in Cicero. I just love that shot. It's old, big snow, and I think 69. So I sort of like that shot. But we're going to have Michael Isaacson, Assistant Director of Community Health at the Kane County Health Department. We're just going to discuss the status of COVID and what's COVID-19 doing in Kane County and other topics related to that. So let's welcome Michael. Michael Isaacson will be joining us right now here. So here's Michael. Hello, Michael.
Hey, John. Good to see you again. How are you today?
I think we'll take down our thermometer. We know what it is. It's 24.4 outside. But we got to do that. That's part of COVID. To know your temperatures is the one good thing on that. But I got to bring up my my welcome. I got a welcome from Michael. We just got to bring him in a proper way. There it's coming. There's that welcome. So welcome. And Michael, Michael's been with us several times, and he's going to just give us a little update. And I want to say, you folks, if you got to read the papers, folks. Michael's in the front page here, Sunday's Beacon. He's on top of the fold, which that's a big counter, Michael. You know that. That's really hot news when it's on the top. No, it really is hot news about how COVID is, and Michael was discussing that. So give us some of your thoughts, Michael, on COVID in Kane County.
Sure, right, John. And yeah, unfortunately, I know every time I give one of these updates, everybody's hoping it's the last one that they're going to have to
see. Right. Well,
yeah, everybody's ready to be done for sure. But there's continues to be good news. We are seeing fewer and fewer cases. So right now, let's see, over the past week, we're averaging about 460 cases a day, which is still quite a few. We had a brief time at the end of last year where we were down below 100. So there's a lot of cases, but it's maybe a quarter of what we were at our peak a month or so ago. So the number of cases is going down. And then even more important than that is the number of people in the hospital with COVID continues to decrease. So compared to the middle of January, we have about half as many people in our hospitals because of COVID as we had on January 15th. So that continues to improve. As we've talked about before, though, that these things kind of go in order. So cases, hospitalizations, deaths. So even though our cases and our hospitalizations continue to get better, unfortunately, we're still losing quite a few people. Just last week, 20 Kane County residents died because of COVID. So those numbers are higher than we like to see them, but we're expecting that to improve here in the near term.
Yeah, I just I'm going to put up my numbers here. You can get these numbers at my website. This is some of the current numbers here in the area. The state numbers, well, they're all going down. It's still high though, but they're all going high. Like 3-day data, we had almost 14,000 cases and 187 deaths. And now I want to get that off the bottom there. We can see what Kane County was here. Let's see what it was here. I forgot now. Okay, well, it only had 2 deaths over the weekend stat, but you brought up over the last week, what you said was about 20 deaths?
20, yes, sir.
Yeah. And the cases here is going, I have 820 there for 3 days. So you said it was over 400 averaging, right, or something before?
Yeah. So, and it continues to go down. So we're moving in the right direction, and it's improving quickly. And then also, I do want to note when we're looking at cases, and this may be a good thing, and I know we've discussed this before, but as we look at the Omicron variant and the potential that it's not causing as serious an illness, we may eventually reach a point where there's still cases being reported, But if it's not making people seriously ill, if we have fewer people in the hospital and people aren't losing their lives, then that's real progress. So just
Yeah, if
important
it doesn't do that, then I guess you would say we're getting some immunity there at the same time. But
yeah, it's a combination, I think, of both immunity and just the way the virus is adapting. So
except these dang variants, though, we don't know, and if you get COVID, it might only this immunizing from the virus getting it might only last half a year. I don't know if we really know how long it lasts.
yeah, no, we're still doing the research and identifying it. So I think as time goes on, we'll start to see, is this going to be something more like the flu shot that potentially we're going to be asked to get annually? Time will tell.
Yeah, it's very interesting, and like I said, we got to really work on the world getting this vaccinations, and I really respect the guy down in Texas, Dr. Hostas, Peter Hostas, and he's working on trying to get the vaccines all over the world and doing it with a non-patented idea and just let them manufacture it in countries. And I think that's a good idea because more variants could be coming, the more out there. It's just still here in the States to be the same way. We just don't know. We got to get more vaccinated. So remember that down at the bottom of the screen. Get your vaccinations here because we got to cut this down. What's the numbers on Kane County vaccinations about right now, Michael?
Well, right now, and I'll use data from the CDC because it also includes our military veterans who are getting their shots through the VA system.
Okay.
But as of yesterday, they were reporting that about 65% of Kane County residents were fully vaccinated.
65. Okay.
65, yep, 64.9 to be
Right,
exact.
right. Okay.
And that's all residents. So when we look at who's actually eligible, which right now only people who are over 5 are eligible.
Right.
So we're about 69% of all residents are fully vaccinated. So that's good news. That's a lot of people who are fully vaccinated, but 30% of people not being vaccinated, that's a lot of people as well. So
You're right.
like you said, we want to see more people get their shots. And good news is, and even though it's slow progress, as more people are coming in to get their booster shots, as the vaccine becomes available to younger people, and we expect actually here before too long to see it available to those under 5, we're seeing along with those people coming in, some people are coming in to get their first shots. So some adults who had maybe stayed on the sideline over the past year are coming forward. So that's great news. Some people were waiting. We just are seeing that Moderna is getting full authorization now. So it's no longer under emergency use authorization.
All right.
So that's something that makes some people feel more comfortable that both Pfizer and Moderna are fully authorized. So getting the shots is an important way to prevent serious illness. Definitely.
Yeah, I saw in the beacon there. That the county. I guess that was the county. Maybe you had other health providers working on that, but Sacred Heart.
Oh yeah,
You
yeah.
had
No,
an outreach at Sacred Heart recently.
yeah, and I should clarify that was not a health department initiative. That's something that we were actively promoting.
Right.
But community groups and were really working hard to get that out there. There's actually a collaborative of people who's working to get more residents in the 60505 area code to get their vaccine. So yeah, the quote made it seem like we were the big drivers.
I
promoting.
know how this. There's a lot of people working on this. The VNA, other health clinics, and so I know that. So, but you're an umbrella group for everybody. So the county. So we really appreciate what you're doing there. And but that 605 had, well, a few weeks ago, maybe it only had 50% vaccinated. I hope it's better than that now, or less even. I don't know. You got any numbers on that one yet?
Yeah,
You remember?
it was in the 40%, in the 40s. So
I
it
know
was
it was. I
significantly
assume
lower.
it went up some here.
Yeah, yeah, yeah. And I have not looked today to see what that number was, and I
Okay. Okay.
imagine the
Well,
data from the weekend's not in yet.
I know my friend Sonny and what's it, Karina? Yeah,
Hmm.
yeah, we're
Yeah.
working on that, and they thought maybe it was getting up there. I think it was 40, 45. Maybe it's getting near 50, but it's still a ways to go there. That's for sure. And the county too. We got to get those numbers up. And I wanted to bring up something that was a little intriguing to me. I've heard about this before, but I saw it in the Days Sun Times. Uh, and I'll back up one thing, but the vaccinations, you can see down in the bottom of the screen, different places to get those vaccinations, the VNA and the Kane Vax. Now, I'll just backtrack one second. When do you offer the vaccinations now at the Batavia site?
So we're operating on Wednesday and Saturday, and people, if you want to go to the canevax.org, you can see the exact times that we have available for appointments.
Right. So that's one way to get it. And the pharmacies most of the pharmacies are offering vaccinations, and we had the VNA, and the VNA also comes to you too if you want that. They have that service. So you can get your vaccinations. There's no, right, Michael, no excuse really on where to find it. It's out there.
That's right, and like you said, the VNA is willing to come to somebody's house if transportation or their mobility prevents them from getting to a clinic. So we want to make it as easy for people as possible. Definitely.
That's right. Now, here's something that I read about. No, and that's a little different way to find out about COVID. It's sewage. Now, I know some of our audience has heard about this, but I heard about this a few months ago too. And then I read an article in the Sun Times today about it, sewage. And I just wondered, you got any idea on monitoring if any of our city waterworks places, are any of them doing any of that type of thing, in Kane County?
I don't know specifically if we are here. We just had a conversation with the state this morning and learned that Winnebago and Kankakee counties are now actively being reported on the CDC's website as part of this surveillance program.
Oh, really? Okay.
Yeah, so it is, and maybe if people don't understand, if it is a good way for us to see what's happening by literally testing the sewage. You can see in a particular area how much virus is there, and that can let us know even before a lot of cases start popping up. So it's a good way for us to get a jump on things and know where there may be areas of concern in our community.
Yeah, the Sun Times article mentions about the freezing. Now, that might be a fly in the ointment here on this thing. I'm sure they're trying to figure out how to get around that idea that might cause some, well, different data to come out. I guess they had, different data when it was low and high, and anyway, that's
Yeah, and I don't have the expertise
no,
in that part of it, but yeah, I have heard that the temperature can have an impact.
and I'll just put up real briefly. You can get this article about this freezing data, freezing sewage, and it's in the Sun Times online. It's in today's paper too, actually, on that. So I just wanted to bring that up, but I would hope that would be a coming thing, and I'm sure it could be used for other types of pandemics or endemics or whatever, how you want to. You're more expert in that terminology, but wouldn't that help on other things too, maybe?
Sure, yeah, absolutely. There's a lot of these surveillance initiatives that we have that help to give us clues. So In some cases, you may be able to see, and none of this is collecting people's personal information, but at an aggregate level, we can see if certain things are being sold at pharmacies at higher levels. That may give us an indication that something's going on, or you may have read that there's some concern about some of the medications we take showing up in higher levels in sewage. So,
Oh, yeah. Well, that's another problem. I'll mention, Michael, you know this, and we don't want to dump our meds in the in our toilets or down.
exactly.
That's all our cities. I know they do it. Have places to drop off your drugs, so don't throw those down the toilet.
Absolutely not. Right. And we have safe disposal kits that we can make available for people, which are pretty handy. It's just a little bit of powder, and you pour it into your pill bottle with a little bit of water, and it creates kind of a gel that you can then dispose of
Oh,
safely
you can
without
do it
worrying.
that way.
Yeah.
It's sort of like how you can neutralize your paint before you throw it away.
Yes, exactly. Exactly.
I didn't hear about that one. Well, anyway, that's an interesting way too. And a lot of, like, I know in Batavia they have down at the police station, they have a drop-off box, and I know in Aurora Fox Metro has a box at their site. And I think Fox Metro is going to be doing more in in April. We got a big cleanup coming up with the Kiwanis, and I'm sure we'll be collecting pills again. So anyway, that's that sewage story. I wanted to get that out of the way. Now, I want to bring up this real fast here. I just talked to Michael before we got on air here about our masks here. You can get a mask at various stores in the area. One store I know of definitely, or two, are Jewel Osco in Aurora West Side, and Jewel Osco on, well, that's not actually in Kane County, down in Oswego. And then I think Meyer in St. Charles is also having masks, and other stores. And I'll be posting them on my website. So I just want to tell you about that. And I'll put that up real fast here. Let's see. We'll have to do a little finagling here. But yeah, that's what I got right now. But I had more too. Actually, I didn't put. There's more yet, but this is just a few here. And but you can look at my website. We'll have more of them posted. So the other thing is, get your testing kits. Now, Michael, you said you got yours in the mail already, huh?
And we did, yes. And I believe it sounds like we probably ordered ours on the same day. And that's something I'm hearing, that even people who got a jump on it and ordered their kits from the federal government, they're coming in at different times. So I know some colleagues who and friends who've received theirs, and some that ordered on the same day as me that still haven't. So hopefully just we can be patient, and they should show up anytime now.
I don't have that link right now, but it is covidtest.gov, I believe, covidtest.gov, and it's a post office site actually, and it's really fast. It's fast to do. I'm just waiting for them to come. And it's supposed to be, I believe, 4, right? I think 4, right? 4 tests.
Yeah, I think that sounds right, but I don't know for sure.
Yeah, it'd be nice to get this before the Super Bowl. If you're worried, get together with friends for that party or something. It would be good to have one of these test kits. And you can also buy them at the stores and if you have insurance, and this is not Medicare, but you'll get reimbursed for your insurance. I think it's 8, maybe. Does that sound right?
That does sound like the number.
By that's I'm under Medicare, so I don't know. I haven't done that one, but they have a lot of test kits, and the price has gone down at Walgreens. They're now about $9-10 instead of 25 for 2 or 24 for 2. So that's a little. But like I said, that goes off to your insurance, so it should be free in the end. So that's why that's supposed to work. So anyway, it's just a couple handy little things to help. beat this virus. And Michael is working real hard with the Kane County Health Department trying to beat this. We'll beat this thing to a pulp. That's what we're going to do. We're going to beat it.
Yeah, we're trying. And actually, something kind of the opposite of the beating, as we move forward here through the pandemic, one big thing that we want to put more of a focus on is behavioral health. And
Well, that's
certainly,
true.
yeah, we did a community health assessment for Kane County and identified several health priorities that we want to address. And the issue that was identified as being the most severe for our residents was mental health.
Oh,
And
that's true. That's a bad one.
yeah, and it's a tough time right now. And whether people have been isolated or lost jobs or just the uncertainty of the virus, there's so many pressures on people. And we have such a divisive political discourse right now, and even things like how people feel about wearing masks. We're seeing that play out in our schools just this week. So it's putting a lot of pressure and strain on people, not just young people, but people of all ages. So over the coming weeks, you're gonna hear more coming out of the Kane County Health Department about our efforts to try to support people's mental health, try to increase access to services, and also just how we can get back to more pro-social things, or getting together with people and doing, being outside, which is, it's not as pleasant when it's 24 degrees, but it'll be spring soon, and people can get out and be active. So we will be talking a lot more about that over the next coming weeks here.
Another thing I don't like to bring this up, but I've gained some weight over the last few months.
Yeah,
and I haven't walked as much and everything. And some of it's related to the virus, not all of it, but that's gaining weight. And I'm not quite just a little above the BMI, but I got to get back to the BMI range. And that, and then diabetes, these things combined, well, especially diabetes with COVID, it's just
yeah, it's not a good recipe. Absolutely. So like you said, we're seeing in the data a lot of people reporting weight gain over the past couple of years. So not just the usual winter or holiday weight gain, but just because people have been cooped up at home in a lot of cases and not in their usual routine.
right.
And like you said, that's especially dangerous with COVID. We know that underlying health conditions can put people at greater risk. And one of the biggest drivers for chronic diseases is overweight and obesity. So whether it's diabetes, hypertension, you name it, getting people out and getting them active, and getting healthy foods to people, those are key parts of our interventions as well.
I forgot. I don't know if you have those numbers in front of you. I don't want to put you on the spot here in this one, but how many of the COVID, well, I guess deaths, or we can go as cases, let's go with deaths, have been over 65 people? It's quite high, isn't it?
It is, yes, yeah. So age is one of the biggest risk factors that we've seen over the course of the pandemic. A few weeks ago, when we were looking at the data, I think the average age in Kane County was around 74.
Oh, really?
Mm-hmm.
And then,
which isn't that old, right? So 74 isn't 17, but these days, there's a lot of people who are 74 who are extremely active and have a lot of life in front of them. So,
and then the other thing is, when you're older, then you have some of these health conditions thrown in, and that's what whacks it all up, right?
That's right. That's right. And there was some information that came out from the CDC, and some of the quotes got a little bit jumbled up, but just looking at among the people who were vaccinated that still ended up dying because of COVID, there was a quote, I believe, from the CDC director talking about how the majority of those people had at least 4 risk factors. So again, the vaccines work and are doing a fantastic job keeping us safe.
But
But
they
we
can
know
only go so far, right?
only go so far, exactly. And that's
Yeah.
whether somebody's vaccinated or not. Those health conditions put people at much greater risk.
My cousin out in California has had the 3 shots. She's older, 10 years older than me. And she had a mild case, maybe a day or something, just congestion, cough. I don't know. But she's good now. But I think because of her 3 shots, and she doesn't have too many underlyings. She does have blood pressure, but I feel good that she had the 3 shots. So that's when you're older. And like I think I mentioned before, when my mother was older, she couldn't get the flu shot because of I think the egg in it, right? There's egg in it.
She had an allergy to the egg.
She had an allergy. So she couldn't get that. So I made sure that I always had that flu shot for being around her. And that's the same with a lot of our older folks. They can't get it. You get it when you're around. Same with our young ones. I hope all parents and everyone that's around those under 5 years old right now, especially that have not had the opportunity. It's coming, but it's not quite yet. And getting vaccinated, it helps them too.
It helps everybody, and even if you have that person in your family who's dead set against getting the vaccine for themselves, just like you're saying, if you get the vaccine, you're helping to protect them, and as many people around them as we can have vaccinated, it's gonna help a lot.
Yes, that's going to be a beautiful thing. Well, Michael, thank you for coming by and just updating us a little what's happening in the county. And we'll find out more about sewage down the road here. I know that's another new topic here. It just came to the front here. No, it goes to the back. No, I won't say it, but anyway, it's in the back always. But it's an interesting topic on just finding our disease and stuff here. That's an interesting way. Well, Michael Isaacson of the Kane County Health Department, thank you very much for being with us here. And I'm just going to give one more little blurb here, and we'll be leaving here in a moment. But on Wednesday, we're going to have Dr. Anthony Harris. He's CEO and medical director of HFIT, and we'll be discussing the COVID, Omicron, and other things about the pandemic. And he's a very good on the broad nature of the virus. So looking forward to him. We've had him before, and it'll be a very enjoyable time. Well, again, I want to thank Michael Isaacson for being with us. Thank you, brother. Thank you very much, Michael. And you have a good week and work with the county there, and we'll keep together. And you let me know anytime we can be of an assistance there. So again, thank you very much, Michael.
Great. Thank you.
So we'll just say goodbye now, and God bless everybody out there. Bye-bye now. Bye-bye.